Today we will get acquainted with one of the most important diseases of our time, and it is widespread among people of all age groups, which is diabetes. Stay with us to get to know it. Since 1991, the world has been commemorating the World Diabetes Day on November 14 each year, which is the birthday of the Canadian physician Frederick Pating, who discovered insulin in 1922, in cooperation with Charles Best. The event was held this year under the slogan Women and Diabetes. What is the severity of the disease? How can you live with it without harming your body? Diabetes is a chronic disease that develops when the pancreas is unable to produce the required amount of the insulin hormone that regulates the level of sugar in the blood, or when the body is unable to effectively use the insulin produced by the pancreas. Therefore, the level of sugar in the blood increases, causing serious damage to the body's systems, especially the nervous system and blood vessels. The first and second types of this disease are spread widely among humans, knowing that type 2 infection is the largest percentage. The first type usually suffers those under 30 years of age, and this type requires daily use of insulin. The second type usually suffers from the elderly. The pancreatic glands in these patients produce the amount of insulin needed by the body, and when certain diets and an active lifestyle are observed, the level of sugar in their blood can be controlled. Statistics indicate that about 50% of people with this disease die from cardiovascular disease. Also, half of those who lose vision around the world are diabetic. Specialist Olga Ditkieva says that diabetes does not affect the elderly only, because heredity is a big factor in the development of any disease. The disease threatens all those who have close relatives, of the first degree, who have it, as well as children who were born weighing more than 4.5 kilograms. There are other factors that increase the risk of contracting the disease, such as the infectious diseases that a woman contracted during pregnancy, as well as measles and mumps. It is mentioned that the first type of disease is caused by damage to the cells of the pancreas, and this may happen in anyone. The second type is easier to control through lifestyle changes. Therefore, when suspected infection, blood and urine analysis should be performed immediately. As for the blood test, it is performed in the morning before eating, and repeated after eating to determine the difference between the two blood sugar levels. The normal level of blood sugar when performing this examination before eating ranges between 70 to 99 mg/dl, and when it ranges between 100 and 125, it indicates that the person is at risk of developing the disease, and if it is more than 126, it confirms that the person has diabetes.